Today is World Mental Health Day, a global movement hoping to educate people about better mental well-being and raise awareness of the stigmas surrounding illness. With the preservation of our mental health in the spotlight now more than ever, who are the people there to help us if things do become too difficult? Well, I'm joined in the studio now by Shushila Ganger, who's a mental health advisor at the NHS Crisis Helpline. Hello to you,
Hi.
Shushila. I think my job's pressured sometimes, but there's no comparison with what you are doing on a daily basis. Just talk us through what your job entails.
So I work on the crisis line, and we take volumes and volumes of calls every day with people presenting with numerous amounts and different amounts of mental health issues. Could be suicidal callers, could be someone with manic depression, could be somebody who's simply caring for someone with a mental health issue and needs support and guidance.
What kind of training do you have to do the job you're doing? Because you really are on the front line.
Our trust, the West London NHS Trust, they offer different sort of trainings throughout the year for their staff. I personally have a diploma in psychotherapy, so I have some understanding of how to work with our patients.
Presumably no 2 days are the same, and as that phone rings, you have no idea who is going to be on the end of the line and what their needs might be. Can you talk us through some of the calls that have perhaps stayed with you?
Yeah, I mean, there are so many to choose from, but I think the ones that usually stay with me are especially are the ones where people are just so lost. They're so lost in their mental health that they're just in despair. They have no hope. And it's them that I really seem to connect to and want to work with, to offer them some hope, some guidance, and offer them reassurance and let them know, you know, someone is there to listen to you.
So a call to you is often the last resort. It's a final plea for help. When you take that call and somebody says they are feeling suicidal, what do you do? How do you respond?
I think listening is key. Active listening is essential. My job there is immediately to build a rapport with this person. Their cry for help, most of the time it is a cry for help, and I need to pick up on that and ask them key questions, open-ended questions. You know, is it that they want to end their life, or do they want to end the situation they are in, or the misery or the pain that they're feeling? And once I get enough information, offering them empathy and understanding, and again, to someone to vent to, not to dismiss the fact that they want to end their life, not to dismiss that, but to listen to that and work with it.
And while you're listening to that, you're also making notes, aren't you? Is that right? That
Absolutely.
Can be used by others to try and help the situation.
Absolutely. I mean, we work as a team, and if I'm with a caller who is wishing to end their life, then, you know, I depend on my colleagues to help me perhaps call an ambulance service or the police and try to locate them depending on where they are. And I can do that without any disruption to my conversation with the caller.
One of the calls I was reading about was particularly poignant that you dealt with. You're about to go off on your lunch break, and you take a call from a young man who's recently lost his wife, and he sees no hope, and he's heading towards a bridge.
Absolutely. And he'd planned it to the point where he'd written a text message and to his sister and his parents, and he'd left his code of his mobile phone so they could read these messages afterwards, get access to his phone. I wanted to engage with him immediately, which we did, and I guess I tried to distract him by talking about his children, and you know, I found out a bit more about why he was doing this, and he just wanted to get rid of the pain. It wasn't so much even end his life, but he could not live without his wife, and he couldn't see a future without his wife. And that's when we started to talk about the children and distracted him for a while. And he was willing to engage after that and move forward.
So you gave him the time and the space to consider his decision, what he was going to do.
Absolutely.
That conversation was about 40 minutes.
That was a very long conversation.
Or?
That can be. It can be very typical. It could be longer. And like I said in the background, my colleagues are working with me. We have this sort of dialogue box we use. So whilst I was talking to him, I was trying to find out where he's located, what he looks like, so then my colleague could call the police and she could get them to him in good enough time. But you have to be honest and open with the caller as well. And I was telling him, this is what I want to do for you. And will you let me do that for you? And in this case, he was willing.
What advice, with the experience you have, with the training that you have, what advice do you have for all of us as to how we can help when those around us, family members, friends, when we feel that they may be in need of some help and support?
To listen and to pick up signs. It's very hard for people when they're, with their mental health illnesses, and if they're feeling suicidal, it's very hard for them to open themselves because of the taboo around it, and because of feeling ashamed of wanting to think like this. But we must talk to one another, and that is very important, and to talk more openly about mental health, not for us to shy away from this.
Shushila Ganger, thank you very much indeed for talking to us. Incredibly powerful to hear your experiences and what you do on a daily basis. Thank you. This is Sky News. Coming up in the next hour.